Hydrocephalus. Hydrocephalus is a disorder characterized by an increase in the size of the head due to fluid buildup in the brain. Most cases occur in newborns due to several reasons that are often ignored during pregnancy checks. Basically, the presence of fluid in the brain is a natural thing and even considered very important because it can protect the brain from injury, maintain pressure on the brain and remove metabolic waste. However, when excessive and there is a continuous buildup, eventually its function becomes unbalanced and makes the head size large. In the brain there is a clear fluid produced in the ventricular cavity. This fluid, which is then called cerebrospinal, should flow from the spinal cord to the rest of the brain to support various. The presence of fluid in the brain basically also has a very important role in addition to keeping the brain from injury, such as keeping the brain fresh, eliminating the remaining metabolic products in the brain and maintaining pressure in the brain. However, when the amount of fluid in the brain exceeds normal size, it will cause medical danger, namely permanent damage to brain tissue. That causes disruption of the physical and intellectual development of children. This condition also occurs because cerebrospinal fluid cannot flow properly in the brain. This fluid buildup eventually makes the head size large and presses on the skull. The balance of the body was finally disturbed. Fluid in the brain that accumulates cannot just happen. There are several things that trigger these abnormal conditions, namely 1. Fluid in the brain that is not absorbed optimally by blood vessels. 2. There is a blockage in the spine or brain. 3. Too much fluid in the brain is produced so that blood vessels cannot absorb optimally. This enlargement of the head size or hydrocephalus cannot just happen. There are several causes that trigger it, including infection during pregnancy, rubella, syphilis, mumps and toxoplasma. In medical cases, hydrocephalus occurs mostly in newborns. In addition to the appearance of an abnormal head size like a baby in general, other symptoms of this disease are 1. The baby's skin looks thin so that the blood vessels are clearly visible. 2. Having recurrent seizures. 3. Irregular breathing. 4. The baby seems unresponsive to the surrounding environment or looks always sleepy. 5. Babies have developmental delays. 6. The legs and hands continue to contract. Hydrocephalus is a type of disease that can still be treated medically even though it must go through a very long process. To reduce or remove the amount of fluid in the brain that makes the head so enlarged is indeed the only way is surgery. Some types of surgery in handling hydrocephalus include shunt installation surgery, which is a series of medical operations by installing a special tool called a shunt. This tool is in the form of a hose installed by the surgeon into the head to drain brain fluid to other parts of the body and absorbed by blood vessels. The part of the body that is often chosen is the abdominal cavity. In order for maximum absorption, this shunt is assisted by valves that function to control the flow of fluid so that the presence of fluid in the receding brain can be controlled. Endoscopic third ventriculostomy (ETV) surgery, which is an operation with the procedure of removing cerebrospinal fluid by creating new absorption holes on the surface of the brain. This procedure is mostly done to treat hydrocephalus due to blockage of the brain ventricles. The purpose of this operation is so that brain fluid does not accumulate in one particular location and can be spread evenly throughout the brain. Hydrocephalus is a very complex medical case. In handling can involve many expert doctors because it involves various organs in the body. The long treatment and through long and varied procedures, indeed cannot restore the situation.